Hello, my name is Dr. Nimzin Ladeb. I am presenting this afternoon a very simple system that I have in place, and I was requested to talk about for the advancement of education in regards to viral hepatitis. It's a digital solution, and the intention is for us to transform hepatitis awareness through innovation. A story of Hepatitis Care Companion. I'm glad to have acquired a medical grant from Gilead Medical Sciences to have developed this solution, which is actually being used globally at no cost to the users. Uh, Hepatitis, particularly, is a silent epidemic. We know that combined hepatitis B and C would ravage about over 300 million people chronically globally. And for hepatitis B in particular, we know that there was a time we are talking of finding the millions, and that is because over 90% of people do not even know that they are actually affected. And of course, you want to know the real problem is that people are dying from this condition every year, about a million people estimated to be dying. And indeed, it's a preventable tragedy that is hiding in plain sight. Well, there's big knowledge gap, and there's a challenge to you and I, and hence the reason for all of us to be in this kind of forum. There's low public awareness of transmission methods. There are misconceptions that are highly held by many people and traditions across the globe about treatment. I was in a social space where people were drinking camel's urine for cure of hepatitis. They're ridiculous. And certain claims about multivitamins being used for cure as well, and lemons and so on. And there's limited healthcare provider capacity. We know that, of course, I was just recently in Tanzania, and we saw maps of how that in one hospital, there will be 30 people per month diagnosed with liver cancer, most of which is due to hepatitis B. And indeed, the number of hepatologists in Tanzania can be counted on fingers. That tells you a lot. And so there is a limited capacity to provide information to those doctors who are not specialists. There's a stigma again about prevention and, of course, testing. People just don't want to even know their status. The loss to care due to poor linkage to care, and the tracking of most effective means of prevention, which is the best dose vaccination, which is the most effective strategy, is very low. Hence, I'm introducing Hepatitis Care Companion as a solution that has dual iOS, that is iPhone and Google Android in over 97 countries globally. It is multilingual and caters for healthcare providers and the public as well. It's a powerful features that you can actually use on your fingertips. It has a library of 20 evidence-based multilingual tutorials in plain language that could be understood by the patient. Liver disease risk checker, and a treatment tracker, which reminds the users about medications that they would have actually imputed by themselves. And of course, they would also have a traffic light appointment scheduling. Within the app itself, if you are able to identify when you are due for treatment, there is a care facility locator for a new person in a particular region. And there's a linkage to care pathway, which is actually seamlessly connecting patients to treatment and follow-up as well. And then lastly, recently, HBV birth dose vaccination tracker has been implemented. Let's break down the barriers by ensuring that there is anonymous access, which would address the issue of stigmatization, meaning that patients can go into this system knowing that no one would understand or even worry about what they're going through, but they would educate themselves. Multiple languages, there reaches diverse communities. there's clear evidence that if a person is able to actually understand a condition in their language, they will engage with it. The reason you're listening to me is because you understand English language. In the same way with patients, if they get their language spoken to them, they will know and follow through. And there's largely offline functionality, which actually works in low connectivity areas. Well, we've got some real world impact. About more than 12,000 installs globally using this app, with no one rating the app below 5 stars. And the stickiness, in other words, how many number of times people go in and come back, is about 27%. Now, that is actually outperforming healthcare apps, which is really telling us that people are going there actively and searching information, and which therefore means that we're coming really timely. The in action, these are what the features are. I will take you one after the other and show you how they do. And if there's time, I will demonstrate to you on a real app. For example, there's a simplified, highly accessible user interface. You can see what it shows and how it does. And then there is the learning modules with certificates on completion. This is essentially for healthcare providers. You can go through from introduction right through to advanced topics. And at the end, you get your track of how well you're doing. And once you've completed, you get a trophy of your certificate being released to you. Right. And then there are traffic light type appointment trackers. In other words, the patient would insert when the appointment would due, and it would be in green when it's in time, and it changes over to amber when it's close, and then to red if they actually is overdue. And thereby, when they see that, they would be reminded, oh, they're missing the appointment, and they can actually make arrangements to be engaged with care. There's graphically simplified liver disease risk checker with a PDF that is downloadable in such a way that if a patient does not even know their problem, and even the healthcare provider doesn't know it, all they would do is to actually go through this. It would generate a PDF, and they can actually take that PDF to their healthcare provider, and they will read and understand the rationale for that decision, and which will guide them as to what to do. Management medication reminders are actually important, using a voice enabler as well as just a notification sound, and that would help them. Here, the two most recent aspects is the linkage to care interface, as well as the HPV birth dose vaccine tracking. These were courtesy of people coming out to me to collaborate, and which we're using at this moment in 2 centers. The awareness campaign has started with strategic marketing across healthcare settings. And of course, I spent some funds on systems to promote the app, and which has gained a lot of traction and accessing and installations. There is discussions with providers, which has led to training of healthcare workers, and who have themselves become app ambassadors. You will see recently on LinkedIn how lots of people across Africa in particular are reaching out, and they're actually getting these patients to install the app and use it as a source of information, and it's digitally really advancing. There are community partnerships engaging local organizations for wider outreach. There is data-driven optimization as well. When people use the information, there's a tracker that lets me know which of the information is most utilized and which is least utilized, so that we can actually iterate different segments of the app over time. Well, there's an opportunity for us to partner, such as public health agencies, to integrate with national screening programs, and also to see how healthcare providers, if you are in that space, to ensure there's a kind of a connectivity with the electronic health records, which is being rolled out in many African countries, and research opportunities as well, because the data is anonymized, and we will be able to gain insights into public health issues such as the HPV vaccine birth dose tracking systems. We will know a lot about where the gaps are and how we can actually resolve these gaps. Here, you can see I'm engaging that you join And we partner together and eliminate viral hepatitis by 2030, which is a goal for elimination within WHO framework. I will take you and see if I can actually show you a bit about what is happening in terms of the app itself. Just bear with me. Here, I will see, here is a device that shows you the app. I guess perhaps you want to see the tutorials for a patient particularly. Here, you go here and you see there are quite a bit of things, multilingual health points. The quizzes are here, which will actually learn on action. For example, you can actually go to the myths here. Can hepatitis spread by sharing needles? Say yes, always. Well, it tells you it's not. It doesn't spread through sharing meals only. Does all hepatitis need bed rest forever? Let's say no. Say it then gives you the answer and gives you direction as to what to do. Is it a lifelong condition? You can say no. And yes, that is saying is correct. And it explains to you further. And then it goes on to actually saying in this situation, well, it also says wrong. And lastly, let's see what happens here. Let's say within hours, oh no, so we failed. And then it actually comes over there and it says, my score is 20%. Well, I need to do better. It wouldn't really rebuke a person, but it actually gives them advice. Well, there is just about that part. And then when you come back here, you will see that it actually shows that your progress is bronze because you have not got to silver or gold, and which is a gamification that helps a lot. And of course, you want to go into more details of tutorials, and you come over here and you see there's English, French, Chinese, Arabic, and Urdu. And these are the languages that is active at the moment. A user can go in, for example, and let's go to Arabic and see what's happening there. Let's see if there's good volume. You might hear one or two words there, which would be appropriate. And then you start.
تقوم الكبد بوظائف هامة في جسمك. معالجة الطعام يحول العناصر الغذائية.
Arabic people can tell us what that is saying, but that is the kind of thing that we are providing to people out there. Real education, real time, simplified, and good to go. Thank you.